Yeah, and that, since I wrote an article on my website, Dr. Greg Hall, and they also learned that Pele had a colon cancer. A number of people.
No,
Yeah,
really?
yeah. I mean, he certainly lived to be older, but that was an issue as well. And so,
Huh.
but colon cancer is, it's one of those cancers that certainly we have an increased risk for a number of reasons, right? Some of it's genetic, some of it's dietary, some of it's not getting screened as we should. Some of it's having a fear of someone putting something in the out hole only, right? There are people that hole is for out only. There's
Totally.
no one's sticking anything up in that hole, right? And so people miss out on, get diagnosed with cancer because that hole is for out only, and that's a problem, right? That sort of attitude, which a lot of people have, a lot of my patients have. If I, what's neat about prostate cancer, we talked about the last time, you can draw a blood test and screen for prostate cancer with a test called the PSA. And that's a blood test, so you don't have to do a rectal exam like I used to do at the beginning of my career. But with colon cancer, a colonoscopy is the best way. Having a scope that goes up your bottom and takes a look and actually can see if there are any precancerous polyps or any precancerous lesions in the inside of your colon. And when they see those, they can take that out, and then it doesn't turn into cancer. And so I always see colon cancer is like the ultimate sort of preventable cancer, certainly the most easily preventable, because you don't have to have surgery, you don't have to be opened up. And if they look and it's all clear, you can go another 10 years. And so colonoscopy is the best way to be able to do that. Yeah.
Could you explain what a polyp is for our viewers?
Yeah. A polyp is just a small outgrowth. I think of it as almost like a mushroom that's growing on the inside of your colon. And that mushroom can swell and ultimately become a cancer. When it's small, it may just be an incidental finding, right? It could be nothing, or it could but some of those small mushrooms on the inside of your digestive tract can grow and turn into a cancer. So if someone's in there looking with a scope, they can actually snare that mushroom, pull it off, and take it out, and then it doesn't grow into anything. And so it's almost like kicking a mushroom off. If you see something, you kick a mushroom over, it's done. It's not gonna, so and that's the same sort of approach with the colonoscopy. You can find these polyps, which are little mushrooms, remove them, and then they don't grow into a cancer that once it grows through the walls, now you need major surgery. Now you need chemotherapy or radiation. Now it's a big, horrible mess. Whereas if we had found it when it was small, like weeding in a garden, you find one weed when it's small and you pull that out, you don't end up with a whole mess of weeds when it's a big problem. And that's like cancer metastasizing, cancer spreading from one region to another. So it's just preventative and proactive is really the answer.
Hi, I'm Dr. David Ajibade. Thank you so much for watching this video. If you would like to see more videos, please click on the subscribe button below. And if you want to be notified of when we upload other videos, please click on the bell button so that you can be notified. God bless. Take care. Bye.